Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Good afternoon, folks. This is Dr. Shailinder Sodhi, and along with my co-host, Dr. Anju Sodhi.
Hello, good morning.
Actually, it is
good
afternoon.
Actually, already.
I think it looks like morning.
Yes.
You know, the weather is so kind of crazy here.
Well, we are in the fall season, Dr. Shailinder, so
Yes.
it seems like morning still.
Right, and the days are getting shorter and shorter, and the good part is that it's probably another month of short days, and then the things reverse. So anyway, what is today's topic, Dr. Anju?
Today's topic is the screening guidelines, like the preventive exams. Why preventive exams are so important? A lot of people, they do not even consider going to a doctor once in a year.
Right. So I think this would be a great topic. We have kind of taken a step away from our routine discussing about different diseases rather, so this time we thought that we would like to, make our audience more knowledgeable about the preventive exam and, why we do need these preventive exams. Because, since a lot of our Southeast Asian population, which means people from India, Sri Lanka, Bangladesh, Pakistan, and almost up to the neighborhood of the China. These, we fall into that category that our population is not really very much adapting to that. They don't even know that they can do preventive exams here in the United States. And some of those who do know, sometimes they are so busy that they don't take time out. And other people are just lost in the insurance reasons.
That's true. And a lot of people, they don't even know that most of the insurances, they cover one preventive exams per calendar year.
Right. And this not only the preventive exam we're talking about, then there is a series of the different preventive exams which they can do depending upon the age group they are in.
Yes.
So, we will be discussing those all in detail today.
Yeah, we will be discussing that, but some preventive exams for the women, it's very important, if not every year, every 2 to 3 years.
Right.
And for the men's as well.
So, folks, if you have a question, please feel free to call us at Desi Radio 1250 at 1-844-301-1250. I will speak that again. The phone number to dial here to the studio is 1-844-301-1250. आप हमारे साथ हिंदी, पंजाबी, उर्दू में भी बात कर सकते हैं. बात करने के लिए आप 844-301-1250 पर कॉल कर सकते हैं. 844-301-1250. तो हम जो आज का हमारा जो टॉपिक है वो सिंपली ये है कि प्रिवेंटिव एग्ज़ाम, जो कि आपको रूटीन में हर साल में आप सभी एक बार साल में या मे बी सम अदर प्रिवेंटिव एग्जाम्स यू कैन डू आप कर सकते हो. तो उसके लिए आप हमें कॉल करें. Feel free to talk to us and anytime, and we'd love to take your questions. So, Dr. Anju, what are the benefits of the preventive exams?
Well, Dr. Shailinder, preventive exam, it starts like we can start. Sometimes I get like my young adults, like they like that from ages like 18 to even like 25, 26. They never went to a doctor for an annual exam or a preventive exam or a blood work done.
I think they probably don't even know that they are supposed to do it. Isn't that probably most of the issues?
That is true. That is true. They don't even know. Like they will go to the doctor only when they are sick.
Right. Only time you see them, or once they have done their pediatrics checkups when, the early pediatrics, which is like when they're born and until they are kind of a little bit adolescent age, then after that they don't even go.
They don't, and parents don't like. And I do suggest my my patients, like if they have the children, it's important to have we need to see that. Sometimes we need to see, like if child is going through something. I'm starting from the children's age, like every year, ages 19 and onwards, and actually before too, like from 15 to onwards too, you can consider a physical exam.
Right, body does go through the changes.
Yes.
And girls, just as they're getting into the hormonal changes, and the boys also goes. So sometimes it is important for them to go and see their physicians for their routine checkups, and if they might have some questions which probably need to be answered.
And also a blood test, sometimes it's not necessary for all the patients, but sometimes if a patient, like the young adults, are having like some issues with the like feeling fatigued, tired, or so we need to check like their blood count, if they are anemic or not, if their thyroid levels are fine too. So many times in the children, thyroid get if they don't go for a thyroid exam, even they are feeling tired, or they are having losing hair or something. Parents do not consider.
Or excessive weight gain happens.
Or excessive weight gain happens. So,
right. So, I think that's very true. I mean, in my clientele, which we see at our clinic in Bellevue, I have seen some patients, there was a surprising fact that we found that their thyroid was sluggish and they were almost borderline hypothyroid, and we were able to correct it with the dietary modification and lifestyle changes. So these type of preventive exams are actually very beneficial for the young age populations.
Yeah, and we at our office, we do it a little bit differently from the the other offices too. So we work with we just don't do the exam, but we suggest them the dietary modifications. And
right. So we're not only doing the routine examinations, but we are also advising about the lifestyle changes, the dietary changes, and what type of the things they can do routinely.
And also with the Ayurveda, because we specialize in the Ayurvedic medicines, we suggest them what the seasonal wise how the eating should be. So there is a little bit differently we do these exams or the tests.
So the folks, the one of the purpose which we do the preventive exam is not only to identify potential health problems in the early stages, but we want to stop the expense which you might accrue otherwise, because if you get sick, which could have been diagnosed earlier, and it really avoids unnecessary hospitalizations and sometimes unnecessary visits to the doctor's office multiple times. So the basic concept of preventive exam is to identify certain things at early stages and address it, which can be modified with the lifestyle changes. Isn't that true?
That is very much true, Dr. Shailinder. And do you want to tell our folks what we do
in the preventive exam?
In the preventive exam?
Usually, when we are doing a routine preventive exams, there is usually, we take a history, which we call subjective history. In that case, that you are telling us what are your main concerns are, and we will discuss your past medical history, any current issues going on, any social or family history we might check. Then usually it involves complete physical exam, and we review the body systems. And we also review your medications. In our clinic, we also check if you are taking any supplements like vitamins or anything, if they are necessary for you or not, or you're doing over supplementation. So we review that, and we also look into any immunization records, and then we kind of consult and discuss all those in routine. And also then we also see age and gender appropriate screening tests. That means if you're in a different age group, then we might say these are the tests. Like if you're a male adult who is into above 40, we might say we probably need to start doing prostate screening, something like. In the females,
Yeah, in the female, the same time, a pap smear is very important to do for the the sexually active women, especially the ages 21 and onwards, every 2 to 3 years.
right. So in this case, where sometimes some girls are actually get active even at early age, and they need to have these pap smear done, and the pelvic exam need to be done by the physicians or the gynecologists on routine basis, because we are trying to make sure there is no exposure to human papilloma viruses,
which is the reason for the cervical cancer in the later stages. And
Right.
So that's very important that for the girls, like the young adults and the women, to have a pap smear every 2 to 3 years.
Yeah, it's based on the risk factors. Sometimes we may have to do every year, or sometime even in a repeat in a same year twice. We like every 6 months to make sure that the risk factor do not exist. So these are the common things which
Yes.
in the preventive exams we do quite a bit.
Yes, and then also the women need to know that after age 40 they are required to have a mammogram.
Right.
Every year as well.
The first thing is the mammograms, I think, is now. So once you had a baseline mammogram, which I call at sometime at the age 40, the recent there have been some changes and advices that if you have not had baseline, try to do before mid 40s and get that done. And if it is normal, then we can skip a year,
Yes.
and you can even do actually 3 years. If there is no family history, then you can go even longer. But I think if there is a strong family history.
And also with the strong family history, if the exposure to the birth control pills is...
And the hormone
Yes,
exposure.
and the hormone exposure, then it's even becomes more important.
Right. And especially, in my every patient who walks into my clinic or in my room, I usually tell them, I ask them very openly, do you really do self-breast exams? I mean, that's one of the education we try to reach to our population, because a lot of people don't even realize how important it is that they can do self-breast exam on their own once in a month, before the cycles, which detects all kind of anomalies.
Yeah, I also advise my patients to do the self-breast exam, and because if women don't touch the body and they don't know what's going on, and if there is anything they feel that there is something unusual they are palpating, then they can call their physician, and that can be easily addressed.
In one survey, the one thing was found that the majority of people have found, first, they have palpated something abnormal because they were doing routine exams, and which was followed by the doctor's exam, and they were able to confirm if those findings were, really alarming for breast cancer, or it was just a benign growth, or it was just simple cyst. So, all these things actually you can do it on your own. And I think we have a call at our studio. So, caller, go ahead. This is Dr. Shailinder Sodhi on the show Your Body's Natural Pharmacy.
Hi, Dr. Shailinder. Dr. Anju, I'm Sagar, and I'm 15 years old, and my question is that I have a cartilage problem in my knee, and it now started causing pain, I think due to winter. So what should I do for this pain?
Right. Sagar, that's a great question. I think sometimes what happens is, as you're growing, from your age, you said you're only 15-year-old. So, at younger age, as your body is growing, sometimes the joints grow, and sometimes they don't grow in proportionately. So what happens is, if you do sports or there is an injury during this phase, you can have a damage to the cartilage. And in your case, you might have a history where you probably injured your knee, and that probably caused some sort of a cartilage damage. But the good thing with your age is that you're in growing age. If this is not very severe pain, if you don't have very severe pain in the knee, the best thing is to get to the doctor and have it looked at and evaluated to make sure there is really a meniscal tear, or if there is a it may be a very much not a cartilage damage. It may be a very much a ligament issue or muscle issues, because the knee joint is a very complex joint. So, it can be palpated, and it can be with the routine examination, it can be put at ease for you that yes, you might have weak muscles. The only thing you need to do is strengthening of the muscles. So all those things can be discussed on your routine examination. So my suggestion is to you, since you are young, make sure you do get an examination and have a physician look at the knees, and also ask the right question is like what type of exercise will be appropriate for you to strengthen your knee joint and the legs. So it may be, and it could be, Sagar, very much issue where you are, maybe you have a too much weight on your knee, or it could be very much like that, you are just growing too fast because you are in growing age, and sometimes the growing pain happens, and we want to make sure if it is really a cartilage issue or it's a growing pain issues. So all those things in your age are very important to rule out. And also we can look into your dietary habit, what type of things you're eating, if your nutrition is good enough to maintain your joint and maintain your body's health. So that would be, appropriate to discuss with your physician at the time of your appointment. So, and sometimes we do blood work.
Yes, blood work, and also, Sagar, it's if you are not taking any supplementation, then maybe there's some calcium supplementation. If you are not a heavy, like the dairy intake is low, then maybe you can supplement with the calcium, and also some vitamin D supplementation is very important too.
Especially living in Northwest,
Yes.
which means in the Seattle, the California, Washington state, and other Northwest states, we have very low sun rays, which mean the majority of population lacks vitamin D. And in our clinic, I find 80% of my patients are vitamin D deficient. So that telling you, Sagar, that's one of the good vitamin to take on regular basis. So,
And
yeah,
I
go
have
ahead.
one more question, that do you think it's due to my feet because they are flat?
Okay, if you got a flat feet, that definitely can put an extra strain on the knees because you lack a curvature, which kind of gives you, we call a shock absorbing action, and it cuts down the strain on the knee. So definitely, if you have a flat feet, you do need a good shoes which have curvature or arc support, and that would be something first I would rather have
Yes,
you do
very
that.
important. That will affect your knee too, and if possible, you should see a podiatrist too.
Right, and we can help you with that too. So, Sagar, it's a great question. Thank you for calling. And we have another caller on the
Thank
line.
you.
Thank you, Sagar. Okay.
Okay. Thank you.
Hey, caller, go ahead. This is Dr. Shailinder Sodhi on the show, Your Body's Natural Pharmacy. And what is your question?
Hi, I'm Sandy from Redmond. I just wanted to know what kind of insurance you all accept in the clinic.
Yes, we accept almost every insurance. Every insurance can have the different plans. And so you may have to check with your insurance, like if there is any alternative coverage. And we all the major insurances like the Primera, Regents, Aetna,
LifeWise.
Healthcare, LifeWise. We take all the insurances, and most of the insurances we can do a annual preventive like once in a year too, and which is completely paid by the insurance most of the time. And a blood work they do like the cover a blood work as well. And if there is any for the women, if there is any pap smear exam, that can be covered. And if there is age appropriate, if we have to refer the patient for a mammogram, we can do that as well. So we almost can do everything at our office.
Right. So, Sandy, it's like all the insurances which Dr. Anju mentioned about, other than the sometimes Medicare and Medicaid, they do not cover the holistic naturopathic physicians. So that is the only exception to the rule. But I have heard certain plans, even that there are some coverage. So they need to check, or the private insurances, if you have, like the example of the private insurances like Primera or LifeWise, and these type of insurance, or United, Aetna, sometimes talking to the carrier, they will tell you if you do have holistic naturopathic coverage or not. And if not, I mean, this is the month when everybody is signing up for the next year's of insurances. So it's a good time when you're buying a plan, to make sure that you do have that coverage which covers the holistic physicians, and that you do have preventive coverage with your naturopathic physician. It's a very important question to ask at the time of getting the coverage.
And also, because at our office, we can provide all these facilities, and also, I think we are a little bit different from the others because we like the details. We go in more details, not only just doing a physical exam and that's it.
Right.
We work with the seasonal routines. We work with how the dietary eating habits are.
Right. And to the listeners, I want to just advise that we have very knowledgeable front desk staff, and our office manager is very knowledgeable in guiding, what type of insurances do cover the naturopathic coverage. So, if you have a question, please feel free to call us at our clinic at 425-453-8022, and we can help, or at least we can guide you in the right direction. I know our front desk gets very busy in the call. Sometimes we are not able to, but we'll love to help you. Or maybe our website also probably can give some information, or you can send us an email through our website, and we can reply to your inquiry about, what type of coverage you can have in order to get a holistic approach or holistic, coverage on your insurance. So that was a great question, Sandy. Thank you for calling. And do you have any other questions?
No, that was very well answered. Thank you.
Thank you. And, that was a very good question, actually.
That was a very good question because, if people, sometimes they do have the coverage and they don't know, so they have to contact their insurance to find it about it. And the other thing is as you mentioned, that this is the time we are changing our insurances, or we are signing up for the new plans, then we have to find out if we have that coverage.
Right. One thing is, I want to talk to my listener, and if you're paying attention, it is so important that when, a lot of people don't even go to the doctors because they think they do not have a coverage.
Yes.
And that is a very scary factor. I mean, I have seen people. I remember one of my case 2 years ago. I had this female patient, without naming anything, who came in, and she was in mid-30s, and the next thing she covered me, and that there was something, she had a wound on the breast, and that turned out to be cancer. And that was a cancer which was very much into metastasizing, and that wound, she had it for more than a year, which she ignored, thinking. Wow. So, folks, sometimes your fear interferes with your just your routine wellness, which can be taken care in early age. And unfortunately, I had to end up sending to this patient to the further evaluation with the oncologist, and we were able to help her out. But anyway, so I don't want the fear factor to take over. I mean, come on, and we will help you out in your well-being check. So we have another call. Caller, go ahead. This is Dr. Shailinder Sodhi on the show Your Body's Natural Pharmacy. What is your question?
Hi, Dr. Shailinder. This is Arun. I have a question. I'm wondering, at your Ayurvedic naturopathic clinic, do you have any treatment for skin lesions? My son has, I don't know whether it's a wart, mole, or some acne flared up. He has some sort of a bump developed for last 1 year.
Uh-huh.
And I'm wondering if you have some treatment available. I don't know, do you do hot or cold cauterization? Excision of some tissues.
Yeah, Arun, that's a very good question. The thing is, the first thing is we need to evaluate what it is. If it is just he's a young boy, right? How old is he?
He is 20 years old.
Right. So, we will just like to make sure it is, if it is really like you're saying, if it is acne related, or sometime it could be skin eczemas or other things, or it's a mole or certain growth, or it's a cyst or ganglion. So based on what the finding is, the treatment can be verified. Yes, to answer your question, we do treat skin conditions, and sometimes we look into the dietary factors if they are the cofactors in causing the skin issues in the young age, which is a lot of time is the case. Isn't that your?
That is very much true. And if is the lesion is mostly on the face, or which part of the body?
It is on the neck, Dr. Anju, and it started with a very small acne, and I thought it will burst over a period of time, but it has not. It has grown in size, not too big, but it is significant enough that it is like visible. It doesn't look like it is a tumor, and actually, my brother's daughter, she's a dermatologist. I asked her, and she thinks probably the right way to do is either cauterized or like the hot or cold cauterization or excise it. She's a dermatologist, but she's in India, so I can't go there. I thought I'll ask you.
I would definitely, you can schedule him, and we would love to look into it. And because sometimes it's secondary to some types of body's response, some sort of reaction from the certain food. And we can suggest you if sometimes the cauterization, that can be done too, but it depends. Like we cannot say without looking at it.
Small excision can be given.
Yeah, so that's like if it's... Yes, so...
but your office, do you have facility for cauterization, or if you have to excise it, do you have the facility?
We do excise, and we do have if we need to do excision, we do that at our office. And if it looks like that it needs a referral, then we give...
freezing.
Right,
liquid nitrogen freezing or something.
Right, we do that all the time, Arun. And, if we think this is require more than our attention, and if it is beyond our expertise, we do not mind referring you to the right doctors, and we do have our network within which we work with. And we can refer you out for case. But without looking at it, it may be not. And sometimes, I'm telling you, simple thing at home, you can do hot and cold compress and see if that works. Usually what I recommend to my patients...
We tried that, and we tried to even beat using sort of like the syringe needle, and it's not helping. So
I will definitely say, Arun, make an appointment, let us look at it, and let us guide you properly in that direction, because I think...
Okay, and are you open on Saturdays too?
We are only open Monday through Friday, and our clinic opens from 8:30 to 6 p.m. And usually our front desk schedules last patient at 5:30 p.m. And feel free to call us at 425-453-8022. Again, number is 425...
Thank you.
Thank you. And the number again is 425-453-8022. That was a very good call.
That was a good call.
Where the parents have done their part, and they are not, they have gotten advice from their family friend and family relatives who are dermatologists, and they're finding that it's not really have worked. So it would be totally good to bring the person into the clinic so we can go further and go to see what can be done. So, this is a really important, folks. So we have generated quite interest in today's, topic. And the phone number to call over here is 1-844-301-1250. And the show is Your Body's Natural Pharmacy, and we are planning to take a break. We'll be right back after the breaks, folks, so don't go away. So here we go.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Hello, folks. This is Dr. Shailinder Sodhi along with my co-host, Dr. Anju Sodhi, and the show is Your Body's Natural Pharmacy. And we are talking about the preventive screening guidelines for healthy adults. So I'm going to give a little bit of, the information about what type of preventive exams need to be done. And Dr. Anju, you can, just interject in between. So first of that, I think the age group where we require to have annual physical exam in the adults from 19 to 21-year-old group is usually annually. Would you agree with that?
I agree with that, but I definitely want to tell the people that if you seeing any symptoms in your child, like anything,
Even
like,
in early age.
even in the early age, like I mentioned earlier, like if there is any sign of like the feeling tired, fatigue for no reason, and then I think it's best to bring for an annual or a blood work or something to start with.
Right. And for the other people, for the younger than 19, usually if they have gone through the pediatrics checkups, the well child being checkups, if you have done those routine things, I think those are good examination screening if they need to do it. But if there are other issues and you need a holistic approach or naturopathic or Ayurvedic approach, you can bring your child to us and we can guide you in with the dietary and what type of lifestyle they should be doing.
And also, because in the young generation, like as they are exposed to like the lot of like the food, like the different type of processed foods, and they are into it. Eating at the school, when sometimes like when the physician talks, somebody else talks rather than the parents, they like make it like better. There is a better understanding that why it's
rather than
the parents fighting with them. For example, like the why it's important to drink a lot of water, like at least few 6 to 8 cups of water every day.
Yeah.
And sometimes the children, like they will take the water bottle and they are not drinking it. So
well, that happens within even our own son too.
Yes.
Sometimes I think
Yes.
the bottled water comes
Yes.
back
So-
and they forget to drink. But it's like emphasizing, the importance of fluid intake is important, and that can be discussed on your annual physical exam. And usually in the screening, when we're doing in the younger age population of screening, we don't recommend colorectal cancer screening unless there is a patient has a family history of high risk. That's the only time where it might get checked, where you can be recommended to see a gastroenterologist for colonoscopic exam or anything.
because in our young generation too, we see a lot of people with the I see the constipation, IBS.
And
These type of things are too.
Yeah,
so
ulcerative colitis.
and Dr. Shailinder, these can be easily can be addressed with the dietary modifications, which if parents are not aware, they are taking the medication. The medication starts there at very early age, but really by changing the dietary habits, we can really help them.
Right. So I mean, if you have a strong family history of colorectal cancers in the younger age group, they need to be looked at and they need to be evaluated. And skin cancers, if remember, we expose ourselves in the summertime and to the people who live grown in the sunny areas, their periodic total skin exam need to be done at least every 3 years, or we can advise you how often you need to get your skin checked. Otherwise, a total skin exam at the total on the advice of clinician, it can be done on an annual basis too, especially with those who have done a lot of skin tanning with those those UV rich those are very dangerous.
Yeah. So this is like different from person to person.
Right, and that's why it is important to see a physician who can evaluate your risk factors. And the age group which are from 22 to I will say all the way up to the 49 year. Definitely you do need all these examinations. You need to be looked at, annual physical, and if you're very healthy individual who follows all the laws of good diet and exercise and maintained a very good genetic, that means your family history is very strong for a healthy individual, you may be able to skip a year. But I usually recommend coming to see a doctor once a year is not a bad idea at all. And then age group which are 50 and onward definitely need an annual exams, and they need colonoscopic exam is recommended at that age.
Yes, that is important.
Yeah, and also the the prostate evaluation. I usually recommend that sometime I start checking the prostates after 40, and we're doing a blood screening test. Sometimes is not good enough, so the digital exams are much more recommended. And if there is a history or looks like there is a history coincides where we may be suspicious of growth in the prostate gland, then there are further tests are advised based on annual physical, which can really save a lot of problem in the male from the middle age group, where they can be diagnosed with the prostate cancer in early and taken care in very early phase. And on the other hand, when the women's, I think like you mentioned, breast cancers and all that, mammography, you said every 2 years.
Mammography every 2 years, like after the baseline, then it's every 2 years.
And that age group is from 50 to 74, you
Yes.
mentioned. And there is, we are recommending that women should consider sometime the baseline mammo from 40 to 50 age.
Yeah, and then again, it's like depends on the how their family history is, how's the hormone exposure is, so all that matters too.
Right, and the lifestyle, definitely involved. The pap smear, like you mentioned, Dr. Anju, is usually once you're sexually active, it is recommended after that. Otherwise, if not, that 21 and up, they should get a pap smear, at least first to start with, and couple of paps are normal, then you can skip a year
2 to 3 years. It's recommended now, every
right.
2 to 3 years.
And we definitely like to, women who are, more active, get checked for HPV.
Yes.
Because that is a, one of the risk factors for the cervical
cancer.
Right. And, that can go all the way up to from the age 30 to 65 when we're doing. When it comes to the men, I do recommend, I said the women need to do self-breast exams. Guys need to do testicular exams. And that is and it's a, month of Men's Health Awareness Month. So I would like to, all my listeners, those who are listening to our show, please do self-testicular exams when you are in the shower. You can usually check it and make sure the texture and all that if you don't know how to do it. So when you come to the doctor's office, ask them to show you how to do a self-testicular exam and what they need to look at. And sometimes those, cancer's growth or small growth can be picked up very early age, and that can avoid really serious consequences out of the testicular cancer. And majority of testicular cancers can be taken care very, if they're caught early with the effective treatments. And, the other things when we are doing in our, Southeast Asian population, and, I'm talking about Greater India population, there is a growth of quite a bit diabetic population. Would you agree with that, Dr. Anju?
That is very much true, and I think we need to discuss some of that as well.
The one of the things which I'm finding, as our population, even back in India, I mean, I do go twice a year to India, and I'm finding a lot of fast food have been come to the play, where people are eating the fast food. They're not eating the home cooked food. The fast food have added lots of calories, and sugar-rich food and bad fat food have all of a sudden a population which used to be lean and muscular.
So when we were growing up, and before I come here, it was like 3 times. And over here, I cook 3 times a day. And back home, I think people have started cooking very less now. So
right. So that's what I was saying. The population which were much more like on lean or muscular side, and all of a sudden half of the population is overweight.
Yes.
And I'm talking about overweight, not the weight from the muscle mass, but from the fat.
From the fat, and also the abdominal fat,
right.
shows the metabolic syndrome.
And the visceral fat is there. So, these are the things which I'm finding in our population. And I do have a caller on the line. So we will discuss this more after taking the call. Caller, go ahead. This is Dr. Shailinder Sodhi on the show Your Body is Your Natural Pharmacy.
Hi, this is Sugandha. I was just curious about how to deal with a stressful lifestyle on a daily basis, like people who are either students or just have stressful lives. How do you recommend students or everyday workers?
That's a great question, Sugandha. The question is the stress in daily life, especially the students who are full-time students, and some of these students are working as well. So what I find, definitely the routine have to be very set for these people. You need to have a set routine where you kind of give that much amount of time to your studying, and then also if you are working, then you need to make sure you balance out that act. Along with that, you need to definitely. I'm a big time proponent of advising doing yoga routinely and
Pranayam.
breathing exercise are best to reduce stress. The 10 to 15 minutes of breathing exercise is equal to almost 4 to 5 hours of deep sleep, which actually release the cut down the cortisol levels. Anytime people who are in stress, either it's a physical stress or emotional stress, what is happening is to the adrenal gland is they are secreting too much of adrenaline and cortisol hormones, which makes you almost in that type of mode where you feel like you are having an anxiety. Would you agree, Dr.
I
Anju?
completely agree with that, Dr. Shailinder. And some of the supplementation is great too. Like when you have somebody has these type of symptom, vitamin D works very well too. We have a product called ashwagandha, which is a herb, which is also very important too for the students. We do have a bacopa, which is brahmi, and that is very good for the students too. So to my patients, good multivitamin, a vitamin D supplementation, ashwagandha and bacopa, advise my patients to take.
And being a student is a lot of work. Being a full-time student, it is even and working, that it adds to a lot of stress. But my advice to all the students who are listening to our radio show, please take 15 minutes to 30 minutes every day for your well-being. That 15 to 30 minutes will give you enough energy and time away from the books, where you will refresh your brain cells and your retention power increases.
Yeah.
So, taking a break from routine or having a good chat or good laugh is always important.
Always. And also, like if you're studying for a few hours, then just take a 5 minutes like pranayam. Do some breathing exercises just for 5 minutes, if not more.
Yeah, I find the attention span usually, kind of have a to go away from the books is usually about 30 to 45 minutes, and in some individual maximum they can focus for 1 hour. So good rule is 5 to 10 minutes break. Every 5 to 10 minutes break, you can go back to your books. So thank you for the question. That was an excellent question. I'm hoping that the students who are listening to our show will be benefited.
It would be helpful
for them. Thank you. So anyway, so we come back to, we have another call. Okay, so we were talking about the metabolic syndrome within our greater Indian population, and what I'm finding is the people are gaining more weight and they're eating not healthy. So these type of things can be checked by your physicians on your preventive exams. With a simple blood work and or physical work, it will give us a total, we will check your blood glucose, we will check your lipids, and those are cholesterols. And we also do glycosylated hemoglobin A1C test, which actually is more predictive of sugar intolerance in our population. And I find even if you have a blood sugar at the normal range, A1C test, which we do at our clinic, gives us an indication, very early indication, if you're a pre-diabetic or not. So these tests are very simple blood draw tests, which can be done and discussed. So we have a caller on the line. We will take the call, and then I'll come back what we have found in the, what is beneficial in metabolic syndrome. So caller, go ahead. This is Dr. Shailinder Sodhi on the show Your Body's Natural Pharmacy.
Hi, Dr. Shailinder, Dr. Anju. This is Priya here. Just wanted to ask about bone health and if there's anything that we can do in terms of prevention or annually to check up, especially in women. We see a lot of osteoporosis and men as well, but what do you recommend for that? What can we do?
The Priya, that's,
Great
it's a
question.
very good question. I'm telling you, I think earlier we both mentioned that our 80% of patients which we find at our clinic are vitamin D deficient. So, when we're talking about osteoporosis and osteopenic, definitely vitamin D plays a huge role in mineralization of calcium into the bone matrix. So, definitely everybody should be taking some, dosage of vitamin D every day. Or, if you don't know if you're low or not, get your vitamin D level checked. And also in the female population, I think it is even more prone, it gets even worse once they start hitting the menopausal, where the hormonal changes happen. So, those things, need to be addressed as well.
Yes, and Priya, if it depends how when women come and after especially their menopausal women, it's like the history taking, how's the eating habits are. That's very important, how they are eating, if they are eating enough greens, vegetables or not. If they're supplementation and a lot of vegetables, like the calcium is not like if they are eating a lot of greens and good amount of the nuts and seeds, and their eating habits are not bad. So calcium, they really don't need to take extra calcium if
and
it's
what
really
I find
not
is sometimes
needed.
people come and tell me that they're taking a calcium, and but not every calcium is absorbable.
Yes, that's the other thing which is very important to know, like if you are, what type of calcium supplementation you are doing.
Right, and sometimes those calcium supplements which they find in the stores are not the good type of, which have an absorption issue. So that's again, Priya, is a question of that's why the importance of going to seeing a naturopathic physicians. Or for annual preventive, these things can be addressed. So the when we're talking about the bone health,
bone density, we need to after the menopausal women, that need to be checked once in a while.
Right,
and,
actually, even before sometime, I recommend,
yes.
depending upon the family
Yes.
history, if there is a strong history of osteoporosis or osteopenia, we do recommend bone density test, and that can be
or if they are like the fractures, if they easily, like some people have the tendency to fracture easily.
even I find that in very young age.
Very young age too. That's need to be, and that need to be addressed accordingly. So it's important to seek some help from some physician, and being naturopathic and Ayurvedic physician, we look at the things differently.
So we do provide a wholesome approach. So that was a great question, Priya. Do you have any other question?
That's about it. Thank you very much.
Thank you, Priya.
Thank you, Priya.
So anyway, we'll come back to the metabolic syndrome, which we were discussing before. That in our population, the people are having a little bit, they're gaining weight, they're gaining fat, and also we are finding when we do the test. One of the tests which I was talking about is the glycosylated hemoglobin A1C test, and that indicates that if your sugar have been abnormal for, at least we can average it about for the 3 months. So anybody who is either at the end of the border of the normal limit or above than 5.6 or into 6 or
yeah,
that.
and Dr. Shailinder, we do tell our patients that if sometimes we cannot, if it's on the higher level, if it's 5.6 is the limit, like the upper level, so we don't tell them that, okay, you are at the risk, you are not diabetic, but you are at the risk. So it's very important that you start taking care of it.
Right, and if there is a strong family history of type 2 diabetes, and if your A1C comes at that parallel, it is a big red flag that you are following to have, just like your parents or grandparents who develop type 2 diabetes. That, it is very much that you will develop diabetes if you do not modify your lifestyle. So when we're doing there was one study done where they mentioned about putting people on glucophage or metformin is the people are given sometime in type 2 to help, because in the type 2 issue is not an insulin, it's just much more a problem of that the insulin is not getting into the proper cellular levels where it can break down the sugar. So what it does is metformin is one way to actually, what it does increases more production of insulin. So what we found, rather than that approach, there was a study done where the lifestyle modifications were done, healthy diet and exercise regimen done over 5 years. The studies which were done indicated the lifestyle modification with the modification with the food and exercise habit had a better outcome than the people who were put on metformin or glucophage. That lots of my colleagues agree with that, even mainstream doctors agree with that we have to have some sort of an exercise regimen when it comes, and cutting down the carbohydrates and simple sugars will take care of type 2 diabetic patients, or pre-diabetic patients we should call. That's important. And to me, it's really surprising that in our population, we are noticing quite a bit people who are going through type 2 diabetes. It's like exploding population which is becoming diabetic.
It is. It is. So it's like as you mentioned, the diet and the exercise is very important. So I have noticed, like with my patient group, like with the metabolic syndrome or the hyperglycemia, they are eating lot of carbohydrates. Our sometimes the vegetarian, like I get a lot of Indian population is vegetarian too. They are eating more carbs. They are not eating, like there is if they are vegetarian, they can still eat lot of the protein through the vegetarian too, but they are end up eating just more the rice, and they are not eating enough. Beans has a lot of protein which they are not eating, and the nuts and seeds, and there is so many good like the hemp, chia, flax. These things are available too, but they are not doing in routine. And for my advice to the people who are vegetarian, it's very, or like they have tendency little bit towards the hyperglycemia, they need to eat enough proteins.
Sometimes I just wish it is the other way around, that they could include some of the complete proteins, even from the animal source like fish and chicken. But I know we come from the country where is a very vegetarianism is very strong. Nothing wrong with it. Actually, I think vegetarian people do live longer as long they do not add the lots of simple carbs,
carbohydrates and the sugars.
Because these are the population we are also seeing are also exploding with coronary artery disease and heart attacks. And when they come, I get totally blown away. They call themselves that they're vegetarian, and they don't consume any red meat or pork, which we find in standard American diet populations, and they're still prone to have heart attacks. And basically, when you look into their wholesome diet, it appears to be that they are not eating the way we should like. So coming to our clinic really helps, that we really guide you what type of wholesome vegetarianism diet would be appropriate for these individuals. So
yeah, Dr. Shailinder, it's so like when I get, like I see the Indian store, the wheat flour, even it's not like the same as it was in the past. It seems like only the white flour to me. Like They say whole wheat flour, but it's not. So those are the few simple things
which really guide you properly. So the one thing is when you coming to our clinic, we are also counseling you according to the season, what type of diet you should be eating in the winter time, for example.
Yes, now like it's like maybe I will like to give some tips. This is the fall season. We are going into the winter season, and so
fall season here in United States is very much like a winter season in India.
Yes,
it's actually more severe than that.
Yes, and so we need to eat a little bit differently. We need to eat like more the warm foods. Like we need to make some soups. We need to make some use some spices which are like more warming spices, like the cumin, black pepper, cardamom, cloves, cinnamon, and also
my favorite is the ginger.
Ginger is great. Ginger is all time great. And also I advise my patients to eat a little bit more oils. Because this is the dry weather.
When it comes to the oils, Dr. Anju, I have to tell all my listeners, not all oils are same, folks. You need to understand, any hydrogenated oil you should throw away from your kitchen.
Yes.
And all the fresh oils which is coming from the nuts and seeds are considered good. Our now favorite is avocado.
Coconut oil, avocado oil, ghee is great all time.
Right. And the only thing you need to make
with the
sure,
organic. It should be organic.
And make sure you don't put too much fat in your cooking, because at the end of the day, it is what you're putting in will go into your body, and it should reflect based on your activity level of how much fat. But again, omega-3 groups, which comes from the fish oil, and for the vegetarian, flax oil, or sometimes from the algae, you need to have it.
Hemp, chia seeds are great too. That can be taken. Soaked nuts and seeds in the winter season are great. Also, like with little bit of the toasted with the ghee is great.
And my favorite winter time recipe is those flaxseed laddus. Those alsi laddus are excellent food for the winter time. Folks, I'm sure you all know how to make those, but can you give a quick recipe, Dr. Anju, on the alsi laddu? It's like taking the alsi seed powders and adding...
Yes, so like you have to take the ghee first, and you have to take some good whole wheat flour, and then you have to roast that into the ghee, and then you have to add some alsi. I do not cook alsi flour too much.
And you should not, because that spoils the fat.
So it's just little bit, and then add lot of nuts and seed, grounded nuts and seeds.
And my favorite, ginger powder, please.
Ginger powder and the jaggery. I use jaggery and I make laddus with those.
Right.
And
Okay, folks. This is a very much a winter recipe which I will recommend you to take, but not to eat too much. Maybe one a day would be good enough.
Yes.
So as the show is coming to an end, so I do recommend all of you guys to consider your annual preventive exams. All age groups, the children's, adults, women's, and older population.
And check with your insurance. We take all the insurances at the office depending on your plan. If you are covered, it's a annual preventive is covered once in a year. So, and our clinic number is 425-453-8022. It's in Bellevue, and 425-453-8022.
And our location and the clinic, we have been there for over 20 plus years. So anyway, folks, thanks for listening to the show. And please feel free to call us at any time. And I hope you have a wonderful weekend.
Thank you.